kipaimara, ukamilifu wa mapaji yake 7, kumfanya Mkristo mkamilifu na kumfanya shahidi hodari wa Yesu Kristo mpaka kufa.
Kupata kipaimara kama Skiza Tune yako, tuma neno Skiza likifuatwa na nambari 738100272 kwa 811.
Mater Hospital welcomes you to its newest satellite medical center at the Well Mall along Langata Road in Karen.
The reason why clients should come to Mater Karen Clinic or Medical Center is because we offer a variety of medical services, to include consultation services which are done by our qualified and experienced doctors.
We manifest the Spirit of Christ in the provision of healthcare to all our patients as we adhere to the values of the Religious Sisters of Mercy.
We provide basically primary healthcare services. So this means we'll follow up patients on an outpatient basis for various diseases, including diabetes, asthma, and any other illness which arises, which does not require complex care. Our staff are qualified and provide effective services which are cost effective and good for our patients.
The various services that we offer at our clinic include pharmacy services, where we have a fully stocked pharmacy run by a qualified pharmacist, and we serve all your prescription needs. We have laboratory services that are run by our qualified lab technologists.
Get more than just basic treatment at Mater Hospital Karen Medical Clinic.
One of the key features of primary care is that we provide health education about various conditions. This would include things like hypertension. We would advise you on things such as how to take care of your health.
We serve our clients within a very short time. We have enough well-ventilated waiting area for our clients. And we have rooms for all those procedures that we've mentioned, well-spaced rooms with enough facilities and equipment. We also have all the decentralized services that are offered from the main hospital, to include ultrasound services that we offer on Wednesdays from 8 a.m. to 5 p.m. in the evening. So feel welcome to Mater Misericordia Hospital, Karen Medical Center.
We take pride in your wholesome well-being. We are always ready to meet you at your point of need.
A lot of health issues are now preventable, and this means that just by making lifestyle changes, we can improve the health of people in the community.
Our esteemed clients and patients, welcome to the Mater Misericordia Hospital, Karen Medical Center.
We have a large, well-ventilated facility, which means that we are able to see patients in a safe environment. And I would ask you, if you have a health issue and you are within the area, please feel free to come and consult us. We're happy to work with you and identify your issue and resolve it.
We are open every Monday to Friday from 8 a.m. to 7 p.m. and every Saturday from 8 a.m. to 5 p.m.
You come and support us in this medical clinic in Karen, in the Well. We are in the first floor. And you just test us. Sisters of Mercy are known for quality because they are all over the world, and especially our care for the sick. It is hard times because of the coronavirus, but we know we will give the best quality.
We just want to welcome all of you to come to our gynae clinic. It runs every Tuesday from 9 to midday. We have the full gynae specialty, all located in one room, one roof. We have a very comprehensive lab. We have ultrasound services, and most of all, we have caring staff who are going to take care of all your needs. So once again, welcome and karibu to this great medical center of ours.
Capuchin TV, kitambulisho Katoliki.
Hello, good morning, viewer. Thank you for tuning in to this live discussion here on Capuchin TV. And this program is brought to you by Capuchin TV in conjunction with Mater Misericordia Hospital. It's a live talk just to help you know to make a good informed decision when it comes to health matters and even to educate your friends and your loved one. My name is Maureen Kimani. Welcome to the discussion. And in the studio, we have a beautiful lady from Mater Misericordia Hospital, and she will be introducing herself as you get to know much more better about our topic of today. Welcome. Hi, good morning, doctor.
Good morning.
How are you doing?
So I'm fine.
Welcome to Capuchin.
Thank you so much.
Maybe you can introduce yourself to our viewers. You say, what do you do in Mater Misericordia Hospital?
I'm Dr. Karen Wangi. Currently, I'm a general practitioner at Mater Misericordia Hospital.
Okay, thank you for coming. And today we're going to be talking about hypertension, but more so focusing on hypertension in pregnancy. But maybe you can define for us what is hypertension in general.
I would define hypertension as like the name suggests, increased pressure, increased tension. So the blood vessels in our bodies are usually like pipes, and just like a pipe with water, the water can be at a high pressure, the water can be at a low pressure. So when the pressure in our blood vessels is higher than normal, that is what we call hypertension. and that is what should be addressed by a medical practitioner. Yes.
Okay, what causes hypertension?
Hypertension has many causes. There are many types actually, but they are broadly classified into two. There's the hypertension which has a reason. There are some reasons once in a while, very rarely, where you'll find the pressure that someone has a reason, and when you treat that reason, the pressure goes away. But now as the population gets older, our lifestyle, we are not exercising, we're eating junk, we are smoking, we drink alcohol, we are living longer. A lot more people are getting another type of hypertension, which is called essential hypertension, which you cannot completely get rid of. It calls for lifelong management. And also now there's another pressure which is only associated with pregnancy, and I think we'll explore it as we go along. Yes.
So you say most of the causes that causes hypertension, it's more of lifestyle, maybe drinking alcohol and smoking cigarettes, too much of it?
No. There's no safe level of drinking alcohol or smoking cigarettes or not exercising. Like generally not having a healthy lifestyle, it catches up with you as we age. And now that people are living longer, that's why more people are getting hypertension. There's also a small familial, a strong familial link with it. Like if your relatives have hypertension, it's likely that no matter what you do, you'll get hypertension. Yes.
And between men and women, who are the most affected with hypertension?
Hypertension affects more the genders pretty equally, but considering that women also have hypertension, which comes from pregnancy, I would say they are more affected.
Okay.
Yes.
Let's talk about hypertension now. When it comes to hypertension, what are some of the medication?
It depends on which kind of hypertension. That's a bit technical, but there are a lot of options. Normally, we are told to start with the classes of drugs that are called thiazides, thiazides, and then there are also ACE blockers, there are ARBs, there are a lot of drugs. There are some that control the pressure from right inside the brain. There are a lot of options for people who are hypertensive, but there's a step ladder way in which you manage pressure, and it's a bit technical, but the doctor has to know which kind of pressure you're treating. Is it because of the hardening of arteries, or is it because you're suspecting that there's something else that is dysregulating the pressure in the brain? Normally, your physician or your doctor will just give you the medication after taking those things into consideration. Yes, but otherwise, there are very many options for blood pressure medications.
Okay, you talked about our family history. If we say, for example, my dad has or has ever had hypertension, I can be at higher risk of getting it. Whatever you find some of the people, there is no family history about hypertension and yet they get it.
Yes, there's also that spontaneous. In some families, it just comes out spontaneously, like generations. No one has ever had hypertension. All of a sudden, there's someone who has hypertension. And usually there's a lot of denial with this kind of hypertension, that no one in our family has hypertension. No one has ever been diagnosed with hypertension. My mother is 8 years old, does not have a single disease, especially hypertension. But still there's always that risk that even you as an individual, no matter what you do, without any risk factors, you'll develop hypertension. There's always that, but it's a very small risk. Again, maybe your family does not have hypertension, but again, you don't exercise, you're overweight, you're eating the wrong things, you're eating a lot of junk, a lot of salty food, highly processed foods, like even sausages, bacon, crisps. Your lunchtime, it's always fries, you've never eaten a fruit. You smoke, you drink, maybe also a bit stressed out at work, but stress is also a small component. I'll have to add that. Yes, you're more at risk, regardless of whether you have a family background of hypertension or not. Yes.
Okay, and let me take you back on the medication part. Once maybe you have the hypertension and the doctor says that yes, you have the hypertension, and you start your medication, is there at a point one reaches you can stop using the medication, or?
No, usually I would not advise you not to go off medication. And usually what happens is that after someone has been on these medications for a while, and you see every time you measure your pressure now it's normal, you decide, I don't need the medication. But the thing people forget is that your pressure is normal because you're using a pill to control it. The minute you stop, the pressure automatically goes high again, and with it comes other risks of complications of hypertension, like you might have a stroke out of the blues, you might have kidney injury, you might have a heart attack. Hypertension is actually also even a risk factor for diabetes. If you have uncontrolled blood pressure, diabetes sometimes follows. A lot of times it follows. So we call hypertension a silent disease. I mean, a painless disease.
Silent killer.
Yeah, silent killer, yes. And also a painless disease. By the time you're feeling pain, it's usually too late. So it's best you take that pill, which your doctor tells you to take. Yes.
And apart from the medication part, what are other ways maybe you can try to reduce the hypertension?
Managing your pressure. There are things that are known to decrease pressure, but if you've been diagnosed with hypertension, it has not been observed that there is something else outside taking medication that will really control your pressure. But I advise people that if you're working out and you have hypertension, you're still better off than someone who has hypertension and is not working out. Same thing, even if you don't have hypertension, if you're working out, you're still way healthier than someone who's not working out. Again, with all other health-related activities, including eating right, avoiding stress, sleeping well, avoiding smoking, drinking, and all those other issues. Yeah, you're definitely better off even if you have hypertension. And sometimes when you include those things in someone who is hypertensive and is smoking, they have a higher risk of heart disease and also diabetes and cholesterol, as we call it. Yes.
When you talk about sleeping well, we know so many people, they spend some time, especially at night, watching movies. They have series to catch about, even the older people. What do you have to say about the sleeping well? How many hours are they supposed to sleep? And maybe in case they have hypertension?
I would say when you don't sleep well, your body is stressed. When your body is stressed, naturally there's always a spike in pressure. Even when you're in pain, there'll always be that spike. So, but if you take about 6 to 8 hours of sleep, depending also on your body, some people are really heavy sleepers. Other people cannot do 8 hours no matter how much you give them. But if you're, for example, sleeping well, it really brings your body back to balance. Not sleeping will not give you hypertension, but not sleeping you'll definitely see those spikes whether you're hypertensive or not. There'll always be those spikes that will show that this one probably has a stress in the body, probably they didn't sleep well. Yes. Okay,
and let's talk about the diet part. Once maybe a patient has hypertension, what are some of the food are they supposed to be taking? Because you were saying about you're supposed to reduce the junk food.
There's no specific food that will work well for you with hypertension, but throughout your life, you should get in the habit of eating healthy. A lot of fiber, a lot of vegetables. Also, if you avoid the processed food, like I've mentioned, diabetes is one of the things that follows hypertension. So if you're eating processed foods and you're hypertensive, diabetes is bound to come faster. If you're hypertensive and you avoid such kinds of food, obviously you might not catch diabetes or it may come much, much slower. Yes.
Okay, and so the only option that we have, it's exercising, eating well, sleeping, taking...
sleep well.
Okay, do you know the funny thing, so many people sleep even for 2 hours?
Yes, I've heard of that.
Because let's say about the young people, they have maybe work, they're studying online things. Do you have to say maybe do young people get hypertension, or who are the most at higher risk of being affected with hypertension? Is it the young people or the older people?
The thing is, in the past years, hypertension has been a disease of the old people. But as we stand today, people even in their 30s are getting hypertension. And it's the hypertension for which you can't find a cause, which means that they'll take drugs for the rest of their lives. Yes, so the prevalence is increasing. So probably the young people are choosing much worse lifestyles. It's a lifestyle disease, so probably they're choosing much worse lifestyles than the people ahead of them. Yes.
And someone was saying having a sporadic headache can be part of hypertension. Is that so?
Yes, but hypertension can cause headaches, especially hypertension. When you don't really have hypertension and you get a sudden headache, it could mean even there's something going on with your brain. Like I've told you, the blood vessels are like pipes. Maybe the pressure is too much and something, but that's usually one of the worst complications. And if you're hypertensive and you're not controlling your pressure as well, a headache could mean the same thing. Yes.
Okay.
Yeah, there's that relationship.
Let's now talk about, because we have dealt with hypertension in general, what is hypertension in pregnancy? Let's talk about it now. We do about the mother thing, the women. We are the women.
Yes, it's us. That's us. So there's this hypertension, or pressure as Kenyans like to call it, that specifically affects women who are pregnant. It's called hypertensive disease of pregnancy. When you say hypertensive disease of pregnancy, it's actually a spectrum, but high blood pressures is one of the manifestations, just one of the manifestations. And it happens when there are problems with the placenta. When the baby is being formed, the placenta actually comes from maternal tissues and the baby's tissues. They come together to supply the baby with food and oxygen and all that. But when there's a problem in the formation, it causes hypertension. Yes, and also women who have had hypertension in their backgrounds, in their families, also at an elevated risk.
And what causes hypertension in pregnancy?
It's that faulty formation of the placenta. Yes, that's one of the most popular theories. Yes, a cause is not exactly identified, but you can say there are risk factors. Like maybe a woman who has hypertension. Back at home, her father is hypertensive, her mother is hypertensive, she'll most likely be hypertensive. If she was hypertensive in her last pregnancy, there's a high risk of her being hypertensive in this other pregnancy. Women who have twin pregnancies are usually at a higher risk. And actually pregnancy hypertension is one of the hypertensions yenye huisha. One of those hypertensions that you can manage until it goes away. But unfortunately, sometimes you get complications which cause you to deliver the baby earlier than normal. Yes, because at some point it becomes very risky for the mother and for the baby. Yes.
So does it go away?
For most people it goes away, but in isolated people, it continues now as the other hypertension which you can't really heal. So those ones will be on medication for the rest of their lives. Then there are those after they deliver. That's why sometimes you deliver hypertensive mothers earlier than they're supposed to be delivered, because it's the only treatment. For those ones, if it goes away, it has gone away, maybe until the next pregnancy. And then you deal with a pregnancy on a case-by-case basis. The next pregnancy, there's a chance it will go away, there's a chance it will remain for the rest of her life. Yes.
So the only option for a mother, if the hypertension, she's having hypertension, it's just the early delivery? Or there's no medication someone can maybe use, or ways to control it?
We actually have medications to control that kind of hypertension, and for most women they are well controlled. That's why it's very important to go for antenatal clinics, because most of the time that's why it's diagnosed. So the medications work for most women, but sometimes for some women it does not work. So start having complications like even convulsions, and other such things. The liver is not even functioning well, and other such things. Pregnancy hypertension also includes things like you've heard of eclampsia and preeclampsia. Yeah, those are like the mental effects. It affects the brain, it also affects the liver and other systems. Yes, it can actually progress into those two. That's when you decide to deliver the mother, regardless.
And how does hypertension affect pregnancy?
Hypertension, again, as I've said, it's a disease of what we call the pipes, which have water flowing in them, but in this case the pipes are blood vessels and the water is the blood. It can compromise the pregnancy because it also destroys blood vessels. So the next thing you know, even your placenta is not working well, and the placenta is one which already had a problem. So it can cause actually a baby even to die in the uterus. That's one of the issues. Then I've told you about even those things like convulsions and brain effects. For women who are not attending clinics, they're usually at a higher risk. They're the ones who get the most adverse outcomes, because they're brought like, she just fell, she had a convulsion, we don't know what's going on, and by the time maybe you diagnose and come with a treatment plan and everything, sometimes it's too late. That's some of the ways it affects. And sometimes now when people progress to eclampsia, you may have to be treated in a high dependence unit or an ICU. Even your blood levels drop. It's really a multi-systemic illness that is best to identify early and to manage early. And by management, I mean sometimes you might have to deliver the baby just for the safety of the mother. Yes.
And when you do, maybe when you compare between Kenya and other countries, do you have to say like, for us women in Kenya, we are at higher risk of having hypertension during the pregnancy.
Black women in general, it's arresting.
Why is it so? The black, why are we?
I'm not sure why, but there's a strong genetic link, and this link is when you do studies in populations, you'll find that even black women in the US are at a higher risk than their white counterparts. So the only difference I would say happens genetically as a result of race. Yes, but again, black people are generally more predisposed to hypertension. Yeah.
Okay, that's very interesting. Everywhere you go, black people, Black Lives Matter, you know. But I think we're going to take a very short break. But when we come back, we shall talk more about hypertension in pregnancy. Make sure you stay tuned. My name is Maureen Kimani, and our guest is Karen Mwangi, doctor in Mater Misericordia Hospital. See you in a few minutes.
Mater Hospital welcomes you to its newest satellite medical center at the Well Mall along Langata Road in Karen.
The reason why clients should come to Mater Karen Clinic or Medical Center is because we offer a variety of medical services to include consultation services which are done by our qualified and experienced doctors.
We manifest the Spirit of Christ in the provision of healthcare to all our patients as we adhere to the values of the Religious Sisters of Mercy.
We provide basically primary healthcare services. So this means we'll follow up patients on an outpatient basis for various diseases, including diabetes, asthma, and any other illness which arises, which does not require complex care. Our staff are qualified and provide effective services which are cost effective and good for our patients.
The various services that we offer at our clinic include pharmacy services, where we have a fully stocked pharmacy run by a qualified pharmacist, and we serve all your prescription needs. We have laboratory services that are run by our qualified lab technologists.
Get more than just basic treatment at Mater Hospital Karen Medical Clinic.
One of the key features of primary care is that we provide health education about various conditions. This would include things like hypertension. We would advise you on things such as how to take care of your health.
We serve our clients within a very short time. We have enough well-ventilated waiting area for our clients. And we have rooms for all those procedures that we've mentioned, well-spaced rooms with enough facilities and equipment. We also have all the decentralized services that are offered from the main hospital, to include ultrasound services that we offer on Wednesdays from 8 a.m. to 5 p.m. in the evening. So feel welcome to Mater Misericordia Hospital, Karen Medical Center.
We take pride in your wholesome well-being. We are always ready to meet you at your point of need.
A lot of health issues are now preventable, and this means that just by making lifestyle changes, we can improve the health of people in the community.
Our esteemed clients and patients, welcome to the Mater Misericordia Hospital, Karen Medical Center.
We have a large, well-ventilated facility, which means that we are able to see patients in a safe environment. And I would ask you, if you have a health issue and you are within the area, please feel free to come and consult us. We're happy to work with you. and identify your issue and resolve it.
We are open every Monday to Friday from 8 a.m. to 7 p.m. and every Saturday from 8 a.m. to 5 p.m.
You come and support us in this medical clinic in Karen, in the well. We are in the first floor. And you just test us. Sisters of Mercy are known for quality because they are all over the world, and especially our care for the sick. It is hard times because of the coronavirus, but we know we will give the best quality.
We just want to welcome all of you to come to our gynae clinic. It runs every Tuesday from 9 to midday. We have the full gynae specialty, all located in one room, one roof. We have a very comprehensive lab. We have ultrasound services, and most of all, we have caring staff who are going to take care of all your needs. So once again, welcome and karibu to this great medical center of ours.
A very good morning. Welcome back to this live discussion of hypertension in pregnancy and hypertension in general. My name is Maureen Kimani, and in the studio we have a guest, Karen Mwangi from Mater Misericordia Hospital, and she is helping us to understand what is hypertension in pregnancy also. How can we control this, and helping women out there who are pregnant mothers. If you have a sister, if you have, your daughter, maybe you can help and educate them. Welcome back, and let's continue with this discussion. Welcome back, Karen.
Thank you.
Yeah, let's talk about high blood pressure. Can it cause miscarriage?
Yes, it can definitely cause miscarriages. When that pressure is directed especially towards the placenta, it's like directing a pipe of water at a very high pressure at a glass. Everything will be carried away, and when the placenta detaches from the uterus, the baby has no other way of surviving. So it's one of the causes of miscarriages.
At what point can it cause miscarriage? Is it because the mother doesn't know, or what can you say about that?
If the mother doesn't know, and if the pressure is not well controlled. Yes, those are the two scenarios, and this will often happen in women who don't attend their clinics religiously, because if you're going to clinic, your blood pressure will always be taken. Yes.
Do they miss the clinics?
It's usually on a case-by-case basis. There usually many issues like even social factors. Some of them don't even have the funds to go to a clinic. Maybe some of them, like our country is diverse. The kind of clinics they are going to don't have that kind of expertise. Yes, so sometimes when women are left out, others feel like I've had 5 children, there's nothing you're telling me. So you come to the clinic when you're almost delivering, So in such cases, if you have hypertension, in such cases you're not diagnosed, things can really go badly.
I think it's very important you can tell our viewer, why is it important for any pregnant mother to follow their clinics and to attend them very perfectly?
Yeah, first of all, I tell pregnant mothers, like, the first thing you should do when you know you're pregnant, go to the clinic as soon as you know you're pregnant. Not wait for 2 months, not 1 month, because the point of these clinics is to make sure there are no problems, and if there are any problems, they'll be addressed early, and hypertension is just one of the problems that you can encounter in the ANC in the antenatal clinic. Yes, so that's usually my message for pregnancy. Just go as soon as you know you're pregnant. As soon as you've missed your period, it's time to go see a doctor. Yes.
We talked about pregnancy, delivery when it comes to hypertension. If a mother has hypertension, they deliver early. Is it because they have to deliver through CS?
It depends. If the baby is very small, it's usually recommended that they deliver through CS because for very small babies, when you have a jacoma, they cannot withstand the pressure of being pushed. Their brains sometimes get compressed to disastrous consequences. Yes, but otherwise, if the pressure has been well controlled throughout the pregnancy, you can have a baby normally at the end of your pregnancy. Yes, but again, now if you've had a CS in the past, most likely you'll just have another cesarean delivery. Yes.
And what causes maybe you may find a mother saying, I lost my child because he or she died in my stomach? What are some of the causes in such scenarios?
Actually, hypertension in pregnancy is one of them. There's also a diabetes that affects women who are pregnant. But most of the causes are said to be because of the malformations of the baby, and because of our setting, we don't have access to such high-end tests in Kenya in general, you know, and sometimes it's not worth it to pursue such tests. Most of the cases you don't even identify a cause, but hypertension remains one of the very important causes of pregnancy losses.
Just to be on the safer side, how long is a mother supposed to be checked their their blood pressure?
If the blood pressure is normal, the mother is just advised to continue the routine clinics if there are no other problems. But if there's an issue with blood pressure, it depends on how well you're controlling it. Sometimes even if you're using medication, you can control medication until the pressure becomes normal, basically normal, just that you're using a pill for it to be normal. And in such cases, you're allowed to go on with your pregnancy. If there are no other issues, you'll basically be treated as any other patient, except that we'll keep looking for any complications, any signs of complications. Yes.
And what are some? You talked about the diet. They should any of the patients having hypertension should avoid junk food. What about the mothers who have cravings for those fries? What are they supposed to do? And they have hypertension. What can you advise them?
I think being pregnant, you get a through pass once in a while. You know, I wouldn't tell a pregnant woman, like, in some cases, in the case of cravings, if she wants fries, she wants fries. There's nothing you're going to do about it, you know. So maybe an occasional indulgence is not so bad. But also, exercise also in pregnancy helps with the pressure. Yes, like we've said, like all health measures are better when applied whether you're hypertensive or not. So again, pregnancy does not last forever. So a plate or two of fries here and then, you know, not every day. I would allow it myself. Yes.
Okay, all right, that's very interesting. And in some few cases, we have had women losing their babies due to hypertension. And sometimes they never knew, but when they get to the delivery room, maybe after the time they're supposed to be delivering the baby, and then you find their hypertension is very high. Why is it so?
Let me see, like we've said, it's a painless disease. Even in pregnancy, most of the time it's painless. Sometimes you only discover when things have gone haywire, unfortunately. That's why it's always so important. Start your clinic early so that someone will follow you through, so that it doesn't come as a surprise. Yeah, but I admit sometimes you come with the baby not moving, you've not felt the baby moving in a while, you have abdominal pain. The only thing that can be found is that you have elevated pressures. I admit it does happen. But again, it's very rare that you've been going to clinic and no clinician has diagnosed it. It's very rare, almost unlikely.
And for the pregnant women, we say, for example, they have maybe other diseases. They have diabetes, and now they have hypertension. What can they do and still they have the pregnancy, they're carrying the pregnancy? What do you advise, or what can they be done for such cases?
In such cases, I'll just tell you to work very closely with your healthcare worker. Attend clinics as you're advised. Take your medications as you're advised. Observe the danger signs. There are things that are called danger signs in pregnancy. And you know, like if your baby is not moving, if you're bleeding, if you have abdominal pain, if you have a sudden headache, we had mentioned headaches. Yes, that's what I'd advise you to do. Otherwise, sometimes life can be a bit of a struggle. But ultimately, if the diabetes and hypertension are caused by pregnancy, most of the time it goes away after you deliver the baby. And if you are taken care of well, everything turns out okay after 9 months.
And you find some of the couples or the women, they find out maybe after 1 month they are pregnant, but they never knew. So maybe they had not planned for the pregnancy. They are filled with stress. Do they have high chances of having hypertension?
No, stress is not such an important factor. But again, you might get an unplanned pregnancy, and in the previous pregnancy you also had hypertension. You know, so there's that risk on top of the stress. You might have an unplanned pregnancy and your mother is hypertensive. You're at a higher risk than someone who is stressed without all those issues. But stress, it's a very small component of hypertension. It would only probably cause a few spikes during the day, not a continuous thing. Yeah.
And for a mother who has hypertension, is there a limit of the babies they can have? Is there?
No, there's no limit. Yes, but again, you'll have to consider so many other situations. There's so many other factors that you'd have to consider. Yes, but usually there's no limit. Again, if you had hypertension in the last pregnancy, it's not guaranteed you'll have pressure in the next pregnancy, but you're at a higher risk. And statistics don't apply to individuals. I can't say 50% will get hypertension, 50% won't, because I had pressure last time. I don't know if that makes sense. Yes, but at some point it's still a game of chance. There's a chance you'll get it, there's a chance you won't. But when you get it at 100%. Yes.
And what advice can you give mothers? Maybe they feel, because we have had cases, mothers losing their baby because they have hypertension. And maybe when you go to the clinic and then they find out you have hypertension, they start getting worried, they might lose their baby. What can you tell them?
At that point, that's the chance where you get to work with your healthcare worker really close, no matter the outcomes. Normally, we start with medication for pressure in pregnancy. After that, if things escalate or it's uncontrollable, your care worker has been working throughout with you. You'll know the options and it will be easier for you to accept it. Again, social support. It's very important to support expectant mothers. Like if my sister is pregnant and she has hypertension, she'll be better off if I'm walking the journey with her than if she was all alone, So sometimes even acceptance of such issues like my pressure is uncontrollable, now I have to deliver the baby, and maybe it's at 6 months, that's even more social than it is medical, like for a woman to accept such issues. Yes, but if you've been walking through with your doctor, you'll know what to expect, when to expect it, it will be easier. But again, I urge people to support your pregnant women and your pregnant friends a lot. Yes.
So the husbands should play a big
role. The
role.
husbands should definitely be there. Some of those decisions are not easy to make at all. They're not really easy. When you deliver a very small baby, maybe at 6 months, the baby will have to be nursed maybe in a nursery, Yeah, but if you've been working with your doctor all along, you'll know exactly why we are doing this. If you just came from the bushes, ran to a hospital, and your baby was delivered suddenly because your blood pressure is uncontrollable, you might have issues accepting that. Yes.
And you talked about the way you might reduce the hypertension is by doing the exercises. You make sure you're eating the right diet. What about the pregnant women? What are some of the exercises that they're supposed to do, and what are some can they not do?
For pregnant women, they're supposed to do exercises that they can tolerate. But commonly recommended exercises include swimming. Instead of jogging, they'll be advised to go on a walk for like 45 minutes, maybe 3 times in a day, or that swim maybe 3 times in a week, not in a day. Yes, but again, if that's too stressful for them, you advise them to find something else, like don't exert yourself beyond your limits in pregnancy. Yes.
So for the mothers who don't know to swim, what others can exercise they can be engaging themselves with?
I really like the idea of walking. I really prescribe walking. It's also very good for your mental health. But others you should not do, definitely weightlifting, running around, even in the gym, no, like that one is out of question. And those extreme things people do, like jumping from the sky, what are they called?
Skiing?
Yeah, skiing, no, and yeah, those things, whitewater rafting, no. Just something gentle, as far as you can tolerate. Yes.
So women who are pregnant, they're not supposed to be seen in the gym at all.
I would not advise someone who's pregnant to go to the gym. Yes.
Is it why is that so?
Because the physical pressure might be too much for your pregnant belly. In gym where like maybe if you're lifting weights, sometimes you have to wear a belt just so that your body does not go out on you, those big belts. So if you're pregnant and you don't even have the luxury of tying up your belt like that, imagine if something goes awry, if something slips away from you. And again, unless your gym trainer is really trained, like really legit trained, you might end up with more injuries than you bargained for. I mean, when you're not pregnant, you still end up with injuries, I would not really advise someone to do gym. Maybe just a small walk on a treadmill, no running, no nothing, Yeah, that's about the only thing I would go with at the gym. But absolutely no lifting. Again, when you breathe hard, and like when you're lifting, you put pressure on your abdomen. just like the pressure probably you put when you're pushing a baby out. Yeah, so not advise gym.
It's not healthy.
It's healthy, but would not advise.
Okay, all right. And let's see, what can you tell maybe people who don't know about hypertension in pregnancy? What can be that one specific thing you want to educate them?
The only thing I tell people is that you never know how your pregnancy will turn out. So the minute you suspect even you're pregnant, the first thing you should do is go to your doctor, you know, because you might assume everything is okay. And there are so many things that could go wrong. You know, you need someone to work with you. You cannot know everything about hypertension, especially if you're a layperson, maybe if it's your first pregnancy. So the gospel I spread is that if you know you're pregnant, if you've missed your period, start working with a healthcare worker immediately. They're the ones who are trained to find out these issues, and actually even so much more that can affect a pregnancy. That's the only solution. The earlier you start, the earlier it is to catch problems, the earlier it is to solve them. Because you're sitting at home, you can never know that you have high blood pressure on your own. You cannot. It will take someone trained.
And talking about miscarriage, you talked about hypertension can be the cause of the miscarriage. What about maybe it's some other health issues with the person and then she has miscarriage?
There are so many causes of miscarriage. Hypertension is just one of them. It's just one of them. There are usually so many reasons why babies get lost. Some of them are easily identifiable. Others, they're not so obvious. Yes, like most, you know, they say that the most common cause is usually abnormalities in the baby. And they actually say that most pregnancies get lost before people even discover that they're pregnant. Yes, so hypertension is just one of them. And since it's easily identifiable and treatable, that's why it's so important to raise awareness on it. Yes.
Okay, thank you so much, Doctor, for that session of hypertension in pregnancy and hypertension in general. Let's now talk about the breast cancer concert that we'll be having in Mater Misericordia Hospital. Maybe you can inform people about that.
Yeah, this is October Cancer Awareness Month, breast and prostate. So at Mater Misericordia at the Well, which is on Langata Road, there's a breast cancer screening on 29th. There will be qualified medical practitioners just looking at your breasts. And my gospel, another gospel, yet another one, is that prevention is always better than cure. It's always better to identify these problems before they happen. Yes, it's easier to treat something. I mean, if you have a small lump, it better be caught early than when you're maybe in stage 4 cancer. Yeah. So come one, come all. And also in all our medical centers, in our satellite clinics, there's one in Thika, there's one at TRM, there's one at Shujaa Mall, there's one in Buruburu, and now the one at the Well. We have free breast and prostate screenings for this entire month. And if you need additional tests, we'll guide you through it. So I encourage people to come in. Yes. Okay, and what about the mothers that are pregnant? They can be checked at any time for their high blood pressure? Yes, for mothers who are pregnant, we have a very good antenatal clinic run by specialists at any Mater medical center. The one at the Well, all the ones I've mentioned, there's always an antenatal clinic. That's the clinic for pregnant mothers, always staffed. You can get all your maternity needs addressed there anytime. Yes. It's one of the best. I can confidently say that. So even issues like hypertension, very easy to diagnose there, and you'll be treated well. Okay. Yes. Thank you so much. Anything you have, any takeaway before we wind up? Prevention is always better than cure. With cancer, with hypertension, and identifying problems early is better than at the end. So it's good to also have continuous wellness checks, even if you're not feeling particularly sick. You know, so that if there's any small problem, it can be treated before it becomes big. Yes, I think that's my parting shot. Okay, thank you so much, Dr. Karen Mwangi from Mater Misericordia Hospital. Thank you for enlightening our view on hypertension and hypertension in pregnancy, especially for the mothers. We have really enjoyed, hoping to our viewer also they have learned a lot of information about hypertension and hoping to learn more things about any other things apart from hypertension concerning our health matters. Thank you so much for making time. Thank you so much to Mater Misericordia Hospital for giving our viewer these live sessions for concerning about health matters. May God bless Mater Misericordia Hospital, the staffs, the doctors, and their patients. Asante sana. Thank you so much. My name is Maureen Kimani. Have a lovely day.
Mater Hospital welcomes you to its newest satellite medical center at the Well Mall along Langata Road in Karen.
The reason why clients should come to Mater Karen Clinic or Medical Center is because we offer a variety of medical services to include consultation services which are done by our qualified and experienced doctors.
We manifest the Spirit of Christ in the provision of healthcare to all our patients as we adhere to the values of the Religious Sisters of Mercy.
We provide basically primary healthcare services. So this means we'll follow up patients on an outpatient basis for various diseases, including diabetes, asthma, and any other illness which arises, which does not require complex care. Our staff are qualified and provide effective services which are cost effective and good for our patients.
The various services that we offer at our clinic include pharmacy services, where we have a fully stocked pharmacy run by a qualified pharmacist, and we serve all your prescription needs. We have laboratory services that are run by our qualified lab technologists.
Get more than just basic treatment at Mater Hospital Karen Medical Clinic.
One of the key features of primary care is that we provide health education about various conditions. This would include things like hypertension. We would advise you on things such as how to take care of your health.
We serve our clients within a very short time. We have enough well-ventilated waiting area for our clients. And we have rooms for all those procedures that we've mentioned, well-spaced rooms with enough facilities and equipment. We also have all the decentralized services that are offered from the main hospital, to include ultrasound services that we offer on Wednesdays from 8 a.m. to 5 p.m. in the evening. So feel welcome to Mater Misericordia Hospital, Karen Medical Center.
We take pride in your wholesome well-being. We are always ready to meet you at your point of need.
A lot of health issues are now preventable, and this means that just by making lifestyle changes, we can improve the health of people in the community.
Our esteemed clients and patients, welcome to the Mater Misericordia Hospital, Karen Medical Center.
We have a large, well-ventilated facility, which means that we are able to see patients in a safe environment. And I would ask you, if you have a health issue and you are within the area, please feel free to come and consult us. We're happy to work with you and identify your issue and resolve it.
We are open every Monday to Friday from 8 a.m. to 7 p.m. and every Saturday from 8 a.m. to 5 p.m.
You come and support us in this medical clinic in Karen, in the Well. We are in the first floor. And you just test us. Sisters of Mercy are known for quality because they are all over the world, and especially our care for the sick. It is hard times because of the coronavirus, but we know we will give the best quality.
We just want to welcome all of you to come to our gynae clinic. It runs every Tuesday from 9 to midday. We have the full gynae specialty, all located in one room, one roof. We have a very comprehensive lab, we have ultrasound services, and most of all, we have caring staff who are going to take care of all your needs. So once again, welcome and karibu to this great medical center of ours.
Ni mwezi wa Rozari, tunaomba kwa sababu huwezi kutenga